Micro-IVF is also known as mini-IVF. It's a minimal stimulation where we use Clomid fertility pills for 5 days, followed by 2 days of very low dose injectable gonadotropin hormones. We monitor you for a few days with ultrasounds, watching your follicles grow, and we take blood tests looking at certain hormone levels, your estrogen level, FSH level, progesterone level, making sure that we know exactly the very best time to do the egg retrieval when the egg is most likely to be mature. When we do the retrieval, thereafter it's just like a regular IVF. So the benefits of micro-IVF for the younger woman who's our most ideal candidate is that it has much less effect on you. We are eliminating the risk of hyperstimulation. There's fewer visits to the office for the monitoring because it's less stimulation, yet maintaining a much better pregnancy rate than with insemination. And the cost difference is phenomenal. It's much less expensive. So a woman going through micro-IVF, as opposed to insemination, has a much better chance of getting pregnant, is paying about the same amount for a much better chance of pregnancy, and yet has much less risk of hyperstimulation syndrome, and much less risk of a multiple pregnancy. With insemination, you can't control how many eggs are fertilizing and therefore implant. In fact, some women will stimulate with so many follicles and so many eggs that their cycles for insemination need to be canceled. This is not a concern with micro-IVF. If a woman stimulates with a lot of follicles, well, then she's gotten a bonus. She's gotten that many more eggs that we can fertilize and that many more embryos that we can choose from to transfer. And we can choose to put one embryo back at a time. We don't need to worry that more eggs that are fertilized can possibly implant, causing a multiple pregnancy.